Hi, I'm Dr. Antonatos, a board-certified internal medicine physician with focus on metabolic care, obesity, and GLP-1. I read today in the news a celebrity recently described her GLP-1 experience as a nightmare. After a single injection, she developed severe bloating, cramping, diarrhea, sulfur burps, dehydration, and eventually needed IV fluids. So, what went wrong? Not necessarily the prescription, not necessarily the dose, and not necessarily the medication itself. Here's what I think happened. First, she reportedly has several complex medical conditions, including autoimmune disease, dysautonomia, and mast cell activation syndrome. Patients with underlying autonomic or gastrointestinal disorder can sometimes be much more sensitive to medications that slow stomach emptying. Second, she may have been what we call an extreme responder. Most patients experience mild nausea, fullness, constipation, or occasional diarrhea during dose escalation. The reaction was far beyond what most patients experience, and it happened after a single dose. Some people simply cannot tolerate GLP-1 medication despite appropriate prescribing. Third, expectation may not have matched the risk. The medication was reportedly prescribed in part for potential anti-inflammatory benefits. While weight loss and improved metabolic health can reduce inflammation over time, GLP-1 medications are not a guaranteed treatment for autoimmune disorders. Now, here is what is important. Based on the reports, she appeared to have started at a low dose. Medication was prescribed by physicians, and she stopped treatment when severe symptoms developed. In other words, this doesn't sound like someone using the medication incorrectly. It sounds like someone who was a poor fit for the medication. And that's a real lesson. GLP-1 medications are not dangerous for everyone, but they are not appropriate for everyone either. Patient selection matters, starting low matters, monitoring side effects matters. Some patients are excellent candidates, some are not. And a small percentage will have severe intolerance even when everything is done correctly. That's why physician guide GLP-1 care is different from simply getting an automatic refill every month. The goal isn't just prescribing medication, the goal is prescribing the right medication to the right patient. Thank you.